Hi, welcome to the Fit and Healthy Today show. Today our discussion will be about natural alternatives for menopause. But first I'd like to kind of define the stages of menopause and perimenopause. Perimenopause is the period of time within about 3 to 5 years before menopause onsets, and it occurs usually between the ages of 35 and 45. You get irregular menstrual periods, which is usually caused by a decrease in progesterone levels. The body doesn't release an egg with every cycle. Symptoms of menopause are obviously irregular periods, menstrual irregularities, breast tenderness, you get clouded thinking, weight gain, sometimes a little bit of insomnia. When we have the total cessation of menses, or your period, then we have what's called menopause, and that's the permanent cessation of menstrual cycles, and it usually occurs between the ages of 45 and 55. The symptoms are hot flashes, vaginal dryness, mood swings, the night sweats, the day sweats. A loss in libido usually is also noted, along with weight gain. When we talk about the actual changes that occur with menopause, we're talking about very sometimes dramatic hormonal changes. Estrogen levels drop to about 1/3 to 1/2 the level that it normally is before perimenopause and menopause start, but progesterone levels can drop up to 1/120th. So you see a substantial decrease in the progesterone levels that can bring across some of these other symptoms as well. The best test that your physician can perform for menopause is saliva testing. Blood does not show progesterone accurately. It can show estrogens to some degree depending on where you're at in a particular cycle. But saliva performed at the proper time of the month is probably the best testing modality to use. When we're talking about these hormones, estrogens and progesterones, I'd like for you to understand the differences in different types of estrogens. There's over 24 different types of estrogens. The ones that we hear most of, or that our physicians will discuss with us, are estradiol, which can come in a synthetic form, or the body will manufacture it in fat cells or through the ovaries as well. Estradiol can convert into 2 different forms. One is carcinogenic, very strong cancer-causing estrogen. The other one is relatively mild, helps with vaginal prevention of vaginal thinning and vaginal excretions. Estrone is one of the strongest estrogens that the body utilizes, and we produce just a minute amount of it. Extremely strong, can be very cancer-causing if left uncontrolled. It is once again produced by the liver and the fat cells. The estrogen that's most predominantly found in the body is called estriol. 60 to 70% of the estrogens produced by the body are this form. It's an extremely anti-cancer form, very Mayo Clinic researched. Suzanne Summers discusses it in her book that she says when she discusses bioidentical hormones. Then we have a classification of estrogens that are estrogen mimickers called xenoestrogens. And those are mostly found from petrochemical fuel oils, pesticides. Dr. John Lee, one of the foremost experts regarding hormone and hormone replacement therapy, natural alternatives particularly, discusses that some of these xenoestrogens can be up to 6 million times stronger than the estrogens produced by the body. So they cause immeasurable type of estrogen endometrial type of cellular growth. The function of estrogen, which is produced by the ovaries, the adrenal glands, and some in the fat cells as well, is to multiply and have the growth of these endometrial cells. When these are left unchecked, or you have what's called an estrogen dominance, then you end up with excessive amounts leading to PMS, endometriosis, fibroids, and eventually to cancer, being ovarian cancer, uterine cancer, and breast cancer as well. The other classification, or the other hormone that we see substantially decrease, as I noted, up to 1/120th is what it ends up being, is progesterone. Very well researched, once again, by the Mayo Clinic, Dr. John Lee, and other European and American studies. Natural progesterones, now mind you, there's a difference between progestins, which are synthetic progesterones found in prescription form, and natural progesterones. Natural progesterones, what they do is they help promote during pregnancy the healthy development of embryos and fetuses. They normalize blood sugar and clotting, whereas progestins, the synthetic form of progesterones, actually can increase the clotting factors and blood clots, whereas natural progesterones do not. They help, they're natural antidepressant and anti-anxiety. They protect against breast cancer and endometrial cancer. They're a precursor for other corticosteroid hormones, particularly having to do with adrenal function, cortisol. And they also help normalize and keep estrogens in balance. So if you have estrogens going out of control, but you have these progesterones that keep it in balance, then you don't end up with estrogens taking over and becoming endometriosis, cancers, fibroids. So when we see this dramatic drop in natural progesterone levels in the body, what we're finding is that the endometrial cells, the cancer cells, go out of control. So progesterone has been found to be, natural progesterones have been found to be very anti-cancer, despite the warning labels that the state of California make us put on the bottle, classifying natural progesterones as being the same as progestins. Okay. Now, I've got this a little covered up here, but estrogen dominance. Once again, we had discussed what are called unopposed estrogens. And when you do not have adequate amounts of progesterone, then you end up with these unopposed estrogens. We know that unopposed estrogens increase hypothyroidism, and it seems to be that we've had a massive increase, at least I'm seeing at my stores, of hypothyroidism among women between their 30s and 50s. They'll come in and yet their blood work will show, and the blood work for thyroid is only about 25 to 35% accurate, but they come in with the symptoms of hypothyroidism, and oftentimes it can be linked to being progesterone deficient. We also see too that when we don't have adequate amounts of progesterone, we don't build new bone very well. Natural estrogens are very bone sparing. They protect bone loss, but progesterone increases the bone growth, the osteoblast production. So what we find with the HRTs, the synthetic hormones, is they were blocking the progesterones so that the body couldn't manufacture new bone. And women like my mother, who were on HRT for years after they had a hysterectomy, have osteoporosis, and they're asking their doctors, why do I have osteoporosis? Well, it's because they had excessive amounts of estrogen dominance and inadequate amounts of progesterone to keep the unopposed estrogens under control. I also see a lot of adrenal exhaustion when we have estrogen dominance. Adrenal exhaustion, women coming in saying at about 3 or 4 o'clock in the afternoon, they're just absolutely exhausted. I mean, they literally can't keep their eyes open when they're driving home. I was there for a little while. The progesterones, as well as some adrenal supports, help to bolster that as well. I think probably the biggest problem with estrogen dominance is caused by all the xenoestrogens, those estrogens from fuel oils, pesticides, pumping the gas, synthetic materials, anything that is petrochemical based has caused us to become estrogen dominant. And now that we're finding MTB in our water, which was an additive added to fuel, and now it's in our water, we're finding all the birth control pill excretions, the hormone replacement excretions in our water. We're getting even more of these estrogens into our body, and as females, it increases the estrogen dominance. There are supplements that can help with these perimenopausal and menopausal symptoms. The ones I've seen probably that help the most in the initial stages are going to be to try and stabilize the hormones in perimenopause. borage oil, evening primrose oil. These are what we call the good omega-6 fats that can help stabilize hormones. You can get some in organic or unsprayed nuts to keep the hormonals in balance, and that would include estrogens and progesterones. But there generally reaches a point when in perimenopause where you're not going to release an egg every single month, where the progesterone levels just fall. And you'll notice, in mood swings, tiredness, insomnia, what we had discussed before that comes about with perimenopause. And what I find, and what Dr. John Lee in a lot of his studies found, and he wrote a book called What Your Doctor May Not Tell You About Menopause. It's a very good book, and it's very science-based and anecdotal, his analysis of patients that he saw coming in his door. And what he found was when he added progesterone cream, a quarter of a teaspoon twice a day, 14 days on, 14 days off for perimenopausal women, 21 days on, 7 days off for menopausal women, that the dramatic drop in hot flashes, inability to sleep, libido would increase with progesterone levels as well. And then we would see some of the hypothyroidism, the slowing down of the body temperature, the tiredness that you get with hypothyroidism would decrease as well. I think there's a really wonderful older study from 1981 performed by the Johns Hopkins University that showed a dramatic 540% rise in breast cancer and 1,000% increase in all other cancers when the levels of natural estrogens fell. These levels of natural estrogens are very protective. I mean, my gosh, when you're seeing this much of an increase in cancer, that's frightening for most women to think about. And once again, as we discussed before, synthetic progestins, which were found in Premarin, or also called Pravera, were not found to give these types of protections that were afforded with natural progesterones. What's interesting is with progesterones, we would see a hair loss, weight gain, which are totally opposite things that we would see with progesterone. When you're progesterone deficient, some of my customers will come in and say, why am I losing so much hair? And it's because either they've got progesterone issues or the thyroid is slowed. And I think a lot of it, once again, is the thyroid slowing because the progesterone levels are just not up there. There are many, many other supplements that are helpful, and I've outlined a few of them as well. As menopause progresses, a lot of women complain about vaginal thinning and vaginal dryness. Estriol, which I noted before, 60 to 70% of the estrogens produced by the body are estriols, can help with some of that thinning of the lining and that vaginal dryness. In addition, it also does slow bone new loss, slows bone loss, not building bone. Once again, the progesterones are what help with osteoblast production, but the natural estrogens can help slow bone loss. There's a product called DIM, and even pharmaceutical companies are doing research on DIM. What DIM is it's high levels of broccoli concentration that basically blocks the bad estrogens but helps you metabolize the good estrogens. So let's say, for example, you're eating a diet high in fruits and vegetables, but they're not organic. So you're getting a lot of those xenoestrogens, the pesticide estrogens. What we'll find is that the DIM will help block some of the xenoestrogens from having a bad effect on the body and remove them out of the body while still allowing your body to utilize its estriols. There is currently some pharmaceutical research being conducted with DIM for breast cancer patients. I know I have customers who are not wanting to use tamoxifen and Aramidex because they're having side effects associated with those particular drugs, who have chosen to use DIM. Very good for estrogen-driven types of breast cancer as well. Black cohosh. Lots of studies, particularly European studies, on black cohosh with about a 40 milligram per day dosage. Cutting hot flashes up to 60 to, I think it was about 80% reduction in hot flashes. And what it does, It's not an estrogen stimulator or estrogen suppressor. What it does is it goes into the estrogen receptor sites and just kind of calms them down a little bit so that you don't have those night sweats and hot flashes to the degree that you would without black cohosh. DHEA, Mayo Clinic research in menopausal women for 10 to 25 milligrams of DHEA. And what they found was that helped increase the overall natural estrogens and natural progesterones, as well as slight testosterone production, which also can help with libido as well. And they found that this DHEA also decreased some of the menopausal symptoms. Once again, there are saliva tests that can be conducted for DHEA to test you for that particular level as well. When we're talking about diet and menopause, I think sometimes it's really easy to talk about supplements, which are very helpful, but diet is a major contributing cause as well. When we talk about xenoestrogens, and as I discussed before, the petrochemicals, the pesticides, and they're having to use more and more and more of it. And now knowing that our water is tainted with a lot of these hormones from all the medications, we're having this estrogen dominance. So whenever you can, if at all possible, eating organic fruits and vegetables lower that amount of xenoestrogens that you're going to be intaking into your body, and therefore can reduce some of the symptoms. Those xenoestrogens, Dr. John Lee had discusses in his book, like I mentioned earlier, can be up to 6 million times stronger molecularly than the natural estrogens produced by your body. So getting rid of these estrogen mimickers or these xenoestrogens would be very helpful for hot flashes and menopausal symptoms as well. Raw nuts, they have omega-3s, 6s, and 9s in them. We had discussed borage oil or evening primrose oil as being very helpful for hormonal stabilization. Raw organic nuts can also help with hormonal stabilization, and they also help with the joints and reducing vascular inflammation in the brain, as we've discussed in our blood sugar or diabetes and cholesterol segments. Avoiding trans fats and hormone disruptors. Besides xenoestrogens and estrogen mimickers causing hormone disruptions, we have trans fats or high levels of meat fats. So the person who goes in to their local fast food restaurant and grabs a burger, fries, and a soda is getting tons of trans fats, or these types of fats that can literally block the good fats from stabilizing the hormones. So keeping these trans fats and these what I will call bad fats to a minimum is very, very, very helpful in helping stabilization of your hormones. Something that I would like to stress, when us women tend to hold our body weight and we hold excessive amounts of fat, particularly around the middle. As mentioned before, those fat cells manufacture some very strong cancer-causing estrogens, and there's been numerous studies that have come out recently about women who harbor or who are obese or who are even overweight having an increased risk of breast cancer, because these fat cells hold on to estrogens, but they also produce these very high levels of very strong estrogens that can be cancer-causing. And when you increase those estrogen levels as well, I have a lot of my menopausal women that will come in and say, gosh, my joints hurt. I'm holding so much water, I feel like a balloon. And what happens then is when they have this estrogen dominance and this excessive weight gain, they're having so much estrogens that they get inflamed, they gain weight, and then it's like a vicious cycle. The estrogens make them store more fat, the fat makes them produce more estrogens. So I would strongly encourage, if you can, a good exercise program that involves some strength training and some cardiovascular training. Of course, consult with your physician first before you start any exercise program, but I believe that would be very helpful as well too. It also can help bolster the thyroid and give you additional amounts of energy that we sometimes see is decreased with menopausal. That's all I have for you on this particular topic today. I'd like to move on to our next segment regarding fitness and a wonderful exercise for sciatica. Hi, I'd like to show you an exercise that I think could be helpful for the most common pinch sciatica. Now this is if you do not have a slip disc or any other abnormalities with your spine, which can be very, very helpful to reduce the pain and the impingement that sometimes takes place with a pinch sciatica, which tends to occur in the lower back area. What you do is you find yourself a nice flat wall, and here we have an invisible wall, and you get your legs in a 90-degree angle, okay? What I suggest then is you push up against the wall with one leg, so let's pretend this one's pushing up against the wall. And I'm going to use this hand and I'm going to resist and push back with the other one while I'm pushing. And I'm going to hold it for 30 seconds, and then I'm going to shift it back and hold that for 30 seconds while I'm pushing up against my wall and resisting. Doing that 2 to 3 times. If you do that a couple of days, I think you'll get some real relief from a standard pinch sciatica that's not related to slip disc or degenerative disc disease. Welcome to the research portion of our show. With us we have Ralph Turchiano, our resident research analyst. Ralph?
Yes, hi. I'm going to cover quite a few topics today. One of them is going to be probably in regards to soy, resveratrol, folate, green tea, and a few other interesting articles in regards to regulation of a few of our drugs. While my stories may not be as interesting as, let's say, for example, some local news channels reporting on how water can be harmful if drunk too much, I'll try to make it a little bit exciting, so to say. All right, first one we'll go with is soy compound may halt the spread of prostate cancer. The cool part about this was in the March 15th Cancer Research, Journal of the American Association of Cancer Research. What they discovered, now remember this is only in animals to start, that when mice were fed soy, particularly the element genistein, and I'm not usually a soy fan, it stopped the spread of prostate cancer to the lungs on average of about 96%. What the doctors also said, Dr. Bergen, who was the head researcher, stated that diet can affect cancer, and it doesn't do it by magic. So I like the fact that the medical community is beginning to recognize the importance of food and how it affects the biology. After that, another interesting article in regards to food, albeit grapes, sometimes people red wine, is one called resveratrol. And what they found with resveratrol, which is quite interesting, it created a situation called apoptosis. And what apoptosis is basically is it causes the cancer cells to commit suicide of their own, which is the main thing you look for a lot of times chemo and radiation. What they also discovered with resveratrol, I apologize for the pronunciation, is it protected normal healthy cells from the radiation treatments for cancer while eliminating those cancer cells. Now, this was primarily done with pancreatic cancer research. The doctors are really not recommending drinking red wine, but at least looking at resveratrol as an important supplement in a person's cancer treatment. They said it had no contraindications, and the doctor also, whose name is Ukunov, said, yet widespread interest in antioxidants, some physicians are concerned antioxidants may end up protecting tumors. They said there's little evidence to support this, and it's basically just a general fear, which is quite cool. After that, another article in mice, the United States probably has some of the healthiest mice on the planet, is folate in heart protection. What they discovered this. Now they gave these mice 10 milligrams of folate or folic acid, which is probably a lot considering the weight of a mouse. What they found out is that it reduced coronary damage from heart attacks by 90%. So, if a person has a history of poor heart health or something along the lines of coronary events, they may want to discuss with the doctor the implementation or taking additional larger amounts of folic acid. Folic acid in the future is probably the next hot topic as it was for vitamin D. And that study basically was done by the Johns Hopkins University School of Medicine. And the head person there was Dr. David Cass. Very good study, very well done. After that, another interesting one is another kudo for green tea. What they found out with green tea is not so much they didn't do the research on green tea itself, What they did the research on green tea was its combination with antibiotics. In certain antibiotics, they discovered that increased the effectiveness of that antibiotic by up to 99.9%. In addition to antibiotic-resistant bacteria, it helped kill off an additional 20%. So, look in the future for green tea being an additional adjunct to basically antibiotic use by greatly enhancing the effectiveness and maybe cutting down the amount of antibiotics that are required. That was released at a conference, the Society for General Microbiology. It's 162nd meeting at the Edinburgh International Conference Committee. After that, now we get to the stuff which is a little bit more complicated. Two things. One of the studies came out recently that found that only 2% of pediatric drug trials reported using independent safety monitoring. Big problem. They found out that a lot of these studies were flawed and that children actually died during these studies. The head researcher is extremely concerned and they're calling for independent safety monitoring committees on all drug trials. 2% is way too low. And its main concern is this, as he quote, pharmaceutical companies with a valuable financial incentive now to include children in the trials. A 6-month extension to the exclusive manufacturing license for a drug if children are included in that clinical trials. Wrong motivation altogether. And now, let's hit Vytorin. Vytorin, you know, of course, has been used often to lower cholesterol. I'm just going to read you a few quotes since we don't have much time in regards to this. The main person that's leading the battle against this Vytorin is not your Food and Drug Administration. The main people are the Senate Finance Committee. Why? Because money was involved. Those drug companies which had Vytorin sat on the effect of this clinical trial, the drug having no positive effect for over 2 years, at least over other cholesterol-lowering drugs. They held it for quite some time to the public. And again, they didn't release it to the public. Then there were emails going back and forth about the doctors concerned about the credibility. These doctors are heroes. They're not going for any financial interest, and in fact, they're risking their careers to come out and tell you that this drug was not effective. He said, he says basically, they tried to interfere with one of the cardiologist meetings. It says, if it is true, the study results would be presented at an upcoming medical conference and, quote, our collaboration is over. This starts smelling like extending the publication for no other than political reasons. In addition to that, the doctor was concerned he'd be seen as hiding something. What's our FDA's response? We sure don't know if it is beneficial, and people who need that treatment will pay with their lives if they're encouraged to avoid treatment. What's the FDA thinking? There are other possible drugs they can use. They're not going to just go off of all cholesterol-lowering drugs to begin with. The FDA cannot become a shill for a drug company. And that's just to give you an idea of what's going on.
Thank you very much, Ralph. Thank you for joining us on the Fit and Healthy Show.
Here we go.